Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm Will Rucker.
And I'm Sierra Owens.
And we are so excited for today's program. This is A Healthier Tomorrow, where we keep it real about mental health, children's wellness, and thriving as a community. Every other week, we're here breaking stigmas, sharing resources, and uplifting our community with the knowledge we need to heal, grow, and win. Miss Sierra, how are you today?
I'm doing well, Will. It's beautiful outside. I'm feeling good coming off vacation. How about you?
Ain't that nice?
It is. There's nothing better than a vacation, y'all, to breathe, enjoy, and unplug. I think that was the most important part of it.
I did notice she was gone.
I was gone. Did you notice? Did you notice?
Oh, my goodness. Well, we have a full roster in the house today. I'm so excited. We've got Chelsea Bishop from Act for Kids Nevada. We've got Ashley Floyd and Dr. Liz Glover from, is it NAMI or NAMI? I'm always saying it wrong.
Well, not with NAMI. NAMI's a partner.
Partner, okay.
NAMI is the National Alliance on Mental Illness.
Okay.
Yes.
Awesome. Well, we are going to get right into our content today because, again, we've got a lot to talk about. I want to start with you, Chelsea. We want to talk a little bit about the history of Act for Kids Nevada and also share a little bit of your story to kind of get us started so we know who you are.
Yes. Well, thank you so much for having me here today. My name's Chelsea Bishop. I'm a registered nurse. I had experience working on a pediatric floor here in Las Vegas. But then my daughter was diagnosed with a really aggressive form of cancer. This was about 10 years ago, and I needed to quit my job to fully take care of her. We had to travel out of state. We chose to travel at first because I kind of knew there was a specialist we wanted to get to. And we chose to, then we would have been sent out of state, and we traveled for 6.5 years to get the care she needed. Wow. She unfortunately passed away, though, in 2021, and miss her dearly. She's our little Navy girl. But having the experience of, going out of state, seeing these really comprehensive children's hospitals, these hospitals with all sorts of services that she needed, and then knowing how it was here. When I get care for my other kids here, I'm going all over the valley to different specialists, different doctors where they need to get care. And our city is huge now. It's growing so big, and our state is too. And I noticed the need. We need that kind of hospital here in our community where families can show up and get all that service they need in one spot. So, just a couple years ago, I started doing a lot of different meetings with people and talking about this more. And we got a group of 9 of us volunteers together to start a board. And we've been an official nonprofit. We're really working to raise the family voice. The board members are highly dedicated. They work hard because they've experienced this too, to try to get health care for their kids. And they notice how fragmented it is. We've got so many amazing doctors, so many wonderful nurses and other healthcare people, but to have systems where they can work in and families feel like they're cared for and safe and can get all the help they need, we really need that for our community. So we're really trying to help raise that family voice.
Yeah, wow. Well, thank you for sharing your story. My heart goes out for, your loss there. And
thank you.
Just appreciate you turning that into purpose for other folks to get a benefit.
Thank you. No, my heart goes out to the families who are in it right now. Some don't have the specialists they need here in the state, and they're asked to travel out of state. And gosh, you have to quit jobs to do that. You've got to have a lot of resources, people to watch other kids, be able to travel up to where you need to go. It's awful to have to ask our families to do that right now.
When we were growing up, my middle sister, actually, she had tumors. And when we lived in Anchorage, Alaska, and my dad would fly with her to San Francisco in order to get the treatment that she needed. And I remember that's the first time I ever went to San Francisco, when me and my sisters got to travel with my mom to go meet my mom and dad for that support. So this hits home. It definitely is something powerful.
Wow. And it's funny. We just talked to someone from Alaska because they were talking about, we've had some similarities with Alaska. We've got a lot of rural communities, but also some strong cities. And how can we kind of model some of the partnerships they've been doing and make that happen here in Nevada. I mean, there's just a lot of similarities there. But that's great. I'm so sorry you guys have to go through that.
No, thankfully she is okay and everything. She had tumors in her brain and her hip. But thankfully my dad was in the Air Force, so they also had that support and that flexibility. And so, the blessing that comes to show as the healthcare, exactly, that you were saying doesn't necessarily happen for all families.
No.
So, and I love you turning the pain into purpose, is what I say all the time, which is powerful and huge. How do you help support the families to continue to advocate for themselves and their child as they're dealing with, such a challenging time?
Yes. Oh, that's such a great question. We've really been encouraging families to speak up about this. We know that our collective voice is strong. And so we've been collecting family stories online on our website, www.act4kidsnevada. They can share their family stories. We've been filming family stories, putting those out. We've been hosting storytelling workshops where families can learn how to share their stories with legislators and other decision makers. Nice. We've had a family listening session. So we've really been trying to help support families that way. And then we've been, if they need resources right now, we do have a board member. Her name's Rebecca Acosta. She is a board certified patient advocate. And so if people are like, I don't know how to get this, what we need, and my doctor's not really understanding, or can't send me somewhere, she can help kind of navigate. So we send some patients to her to, if they need those services right now. But otherwise, we really want people to feel like they can speak up about this.
Yes.
You can be kind in your advocacy. You can use your strong voice and share what we need here in Nevada.
One of my favorite quotes is clear is kind.
Yes.
Mm-hmm.
And a lot of times we confuse kindness and niceness.
Yes.
And so I absolutely agree. We need to be very clear with the message and advocate for what we need,
right,
and share that,
right,
recognizing it's folks' jobs. Like, these are their jobs to help us, and they want to help, but if they don't know how, then we're actually doing them a disservice as well. So I love that you're elevating the family voice and really bringing us together. So talk a little bit more. You mentioned the freestanding children's hospital and how that will impact our state. What are you most excited about with that coming, and how is that going to transform the healthcare landscape?
Yes. Well, a little background there. We, just within the decade or so that I've been kind of talking about this, I've heard of plans being formed and then failing. And even just a couple years ago, I went to a presentation. There were plans and it did not work. It fizzled out. And so now we do have a community partner that's announced they're going to build it. And it's so incredible and so exciting. So Intermountain Health is coming and they're planning on building it. But it's thrilling because all the services that we need could potentially be in that building, and it'd be so wonderful. We know, though, that just building a building isn't going to just solve everything. We still have other services that need to be streamlined, and policies that really affect, kids and families, and how many doctors are in our city and how many doctors are in our state. If we don't have enough training programs for them, we can't retain doctors. There's, as far as I'm understanding, there's only one pediatric fellowship here. Doctors are known to stay where their fellowship, where their last bit of training is. And so if we only have one, there are dozens and dozens that we would love to have. Those doctors would stay in our community. They stay out of Vegas because that's where their end of training is. So they all have to be recruited here. So anyway, lots of policies that can be changed to help support this and streamline community services to really, help our state. So it starts with the Children's Hospital, but it goes beyond that. There are other ways that can help bring more comprehensive health care, more of that wraparound services that can be here for our community.
You talked about Intermountain Health being committed and dedicated to building the hospital. What other coalition building needs to occur with partnerships or with other organizations to truly make healthcare accessible and equitable for all, especially our children?
Oh, that's such a great question, because coalition building is something we've heard over and over. We've reached out, to mentors and people who've helped, shape how we are going to run this nonprofit. And they say coalition building is so key because it really brings the partners together and helps create that unified voice. And it goes across the state. It has to be something that goes across the state. As coalitions are built, those decision makers can listen to that clear voice together, and people can be asking for the same thing, and just the rallying up of the community can help create that buzz that our kids are important, and kids make up 20% of our community right now, but guess what? They're 100% of our future.
Yes.
So,
Yep.
And I just heard that from the director of AAP, and I said, oh my gosh, that is so true.
I'm in education. I'm going to be still in that, actually, for sure.
Yeah.
That's that tagline that's going to drop, mic drop, and be like, Chelsea Bishop taught me.
That's right. You are listening to A Healthier Tomorrow, Nevada's #1 community health radio show, right here on the People Station, Power 88.1. We are here with Chelsea Bishop from Act for Kids Nevada. We also have Ashley Floyd and Dr. Liz Glover in the house. I want to bring them into the conversation because they have some mental health tea. And I use that as a double entendre.
We today.
And Chelsea, you mind sticking around with us?
Yes.
Awesome. Well, Dr. Glover, why don't you kick us off?
Yes, so I am Dr. Elizabeth Glover, and major advocate. That's been what I've dedicated my life to as a sociologist, and I take that everywhere I go. So that extends to my role as the health chair for the National Coalition of 100 Black Women. And so we advocate for women and girls of color to have their health needs heard, everything from maternal health to mental health. So what's so exciting about this tea is that, I'll be honest, we've done a tea before, a mental health tea, by ourselves in CBW. But one of the things that's not only a national pillar, but just a personal value of ours as a chapter is that we work as a coalition, like Chelsea talked about. There needs to be more coalition building, more solidarity, more cohesion and partnership. So when we saw that the Deltas and NAACP, which I'm also a proud member of, that they were already doing a tea on health, specifically mental health, we said, okay, let's put up our hands. How can we help? And Ashley was so gracious to receive us. So I'll let Ashley go a little bit more into what the mental health tea will focus on.
Yes, we're very excited. First, thank you, Dr. Liz, for the collaboration. It is the Black Women's Mental Health Tea and Talk. And Tea and Talk is a program that Las Vegas alumni chapter of Delta Sigma Theta Sorority Incorporated has done for a long time. And the focus for mental health has been pushed through our physical and mental health committee. And as a mental health advocate and peer recovery leader in the community, I have a vested interest in ensuring that our community is mentally well and that we are pushing mental wellness. So this Tea and Talk is an opportunity where Black women specifically get the opportunity to have a safe space to discuss their wellness, what's hindering their wellness, and how to get the help they need. So we will have a mental wellness discussion, and that's where NAMI comes in, the National Alliance on Mental Illness. They have a program called NAMI Sharing Hope, which is a conversation series geared towards the Black community. It's a for us, by us type of program. And in that series of programs, they have some for Black men, for couples, for youth, and this one is specifically for Black women. And so we'll have that mental wellness conversation, and we'll also have a panel that is full of, we are excited about the panel, and I will be letting Dr. Liz share more about that, but we'll have a panel of mental health professionals and community leaders, and we'll provide resources. Another one of our partners is the National Association for the Advancement of Colored People, and NAACP is going to be providing a self-care toolkit and community resource directory.
Wow.
And so that is something we're excited to launch. I am also a member of NAACP on the Health and Wellness Committee. So we are just full of great organizations, great community leaders that are planning this opportunity, and we're so excited to bring it to the community.
That sounds absolutely amazing, Miss Ashley. It's crazy. I'm a member of Alpha Kappa Alpha Sorority Incorporated.
All
60
right,
seconds say that. Right.
Okay,
I was like, let me see the elephants in the shirt. As soon as it clicked, I said, right now I see it. I was right in front of my face. So as far as it goes, Dr. Liz, what type of mental health professionals and community leaders will be on this panel, and what might be covered? Because Ashley has us excited.
So there'll be all kind of mental health professionals and leaders. For one, myself as a sociologist, I'll be there. And it's very important that we understand the social dynamics that impact how we approach our health, the health care we receive, and all of those interrelated dynamics. We're going to have a licensed marriage and family therapist there. We're going to also have a psychiatric nurse practitioner, a mental health and substance abuse counselor, a life coach, and even some additional panelists such as peer recovery coaches. So we really have a panel of subject matter experts. We aren't just coming to the body with passion. We are bringing, like you said, that purpose, and we're qualified to talk about it so that we empower our people.
Wow, I'm excited.
I know, you gotta come.
No, don't worry. You know, I'm sitting there and I know that's going to be one of the last things, but what is going to make this like really unique and stand out outside of just having a dope panel and really having full wraparound services of what it really means to address the mental health of the black woman? Mm-hmm. But what else is going to make this event unique, and what will I gain when I attend?
Let me tell you, the first thing is that it's a safe space.
Yes, that's right.
It's a safe space. This is an opportunity to lay it out. Put it out there. The NAMI Sharing Hope wellness discussion, the title was called Healing Out Loud. Wow. And a lot of our black women suffer in silence because of the strong black woman stereotype. We cannot let our guards down. And unfortunately, in this world, black women become competitors. As we're fighting our way up the ladder, hitting that glass ceiling, limited by being black and female, we end up sometimes seeing our own sisters as competition. And we sometimes lose the need, what we are supposed to be, which is in community and supporting each other. And so this is a safe space to rebuild some of those broken places where we feel like we may have lost support, lost the courage to share what's really going on and been limited. So the mental wellness discussion is a special discussion that allows us to lay it out there and heal out loud. With the panelists, the thing that's so important, the panelist part, the uniqueness of that is also we are not just having predetermined questions and you just hear us talk off of what we think you should know. There is engagement throughout the entire panel discussion for the people in the room to ask the questions they want to know. So it is about us, for us, and we want to make sure that people feel like they leave with what they need. And another opportunity is that, you know, we have an issue with culturally competent care here in Southern Nevada, in Nevada all the way.
In our nation.
Across the board.
And so not only are we providing access to professionals in the community who are black women for them to network with and get some assistance in finding that care, but with NAACP, they are compiling black professionals in this document. So it's also providing the resource to find people who are culturally competent and knowing how to serve us.
Wow. So, I mean, I am 1000% in support of this and so happy that it's happening. And I'm going to say I might be a little jealous. As the only, man in the room. When's my tea? When we going to have some tea for me?
Well, you know what? There is actually a men's mental health event coming up as well. Can we shout that out really quickly? Yeah, because we can't forget about our men, right? So there is a men's event as well, and that is called the African American Men's Health Summit, Prevention and Wellness. And you know what? What I love about the flyer that's going around is that it has a letter addressed to you all as black men from us, as the black women that love you, adore you, need you around, and advocate for you. Yes, it is. So that'll be April 26th, 9 to 2, free, open to the public, and it'll be at Doolittle Adult Center as well. So get that on your calendars, men and ladies. Listen, accompany them, get them there. We're the neck that turns the head.
That's right. That's right.
And when's the tea?
Right. Oh, the tea is actually, I thought you never asked, Chelsea. So the tea is actually on Saturday the 5th, so next Saturday. It is also at Doolittle Senior Center, and it's from 10 to 1. So many community partners, so much free information, and it's a chance for us to get cute as ladies, right? You can wear whatever makes you feel comfortable at a tea and come enjoy the environment with us. I do want to be clear, both that men's event I shouted out and this event, it's not just adult women. We want to encourage the next generation because, like Chelsea said, they're 100% of our future. So they need to see us leading by example in these spaces, right? But in order to do that, they have to be invited to the table as well. So we want to make sure that we are also just encouraging our teenage young lady, men and women of the future to come as well.
Brilliant.
So bring them along too.
Yes, I told my boyfriend about the men's event. I said, bring your son.
Yeah.
I think
well, you gonna get him there.
Time. Oh, yes. Definitely.
Saturday, April 5th, 2025 from 10 a.m. to 1 p.m. at the Doolittle Senior Center. That's located at 1930 North J Street in Las Vegas in the 89106. The audience is open to black women ages 14 and older. This is completely free. You can search and register online at Eventbrite using the title Black Women's Mental Health, or just Google. I'm sure it's going to pop up.
Oh, yeah, we everywhere.
Awesome. Well, I want to make space for a little more conversation. Y'all are got me in this. I'm excited about this. But Chelsea, with your story, that was really powerful, and I know that mental health is a huge component. So I want to hear from kind of each of you, but starting with you, Chelsea, why is mental health important to you personally?
Oh my goodness. Wow. It affects everything. If your mental health isn't there, you can't take care of yourself. You can't take care of your kids. It's something that, you try to be selfless and try to look outside, but if you've got to keep yourself in check first, and you can give, you can pour out to others, and it's so important. Yeah, that's why it's important to me. I want to be able to give to others, but I can't give to others if I can't take care of myself first.
So true.
Yeah. And I think mental health is just important from a stance of validation. Again, like Ashley said, too many people suffer in silence. And when we can raise awareness, we get to break down some of those barriers and the stigma surrounding mental health. Get people more comfortable to talk about it and to get the support they need, and know that there are mental health professionals, even throughout this valley, that look like us. And a lot of the reasons why they got into that field is because they recognize there was an underrepresentation. We've been through a lot, and for me it's important because there's so much generational trauma that was passed down going back hundreds of years. And some of the things that we do to this day as black people is for the sake of social order, because that was we were trained to. So that includes us silencing that mental strain because we're afraid to open up about that, to receive the help, or we think that the help's not there.
Yes.
And break down the stigma.
Listen, I will tell you all on air, okay? I'm a huge advocate for personal mental health, putting myself in therapy, introducing my children to therapy. And even when my kids are like, Mom, I'm sure this is everyday stuff, we don't need a therapist, I need them to normalize therapy so that it is a part of their toolkit. So now when they are adults and life does get thicker, they're quick to make a call to a therapist, right? I want it to be as frequent as going to the gym or going grocery shopping. We need this support.
And I think it's also important for us to share stories. And again, that's why the Black Women's Mental Health Tea and Talk is so important, because we're spilling the tea. The tea is getting out because we're not having those conversations.
Right.
So are we creating those safe spaces with our children to have those conversations? And that's really important. As a person who had mental health conditions as a child, as early as 10 years old, I know that I had very limited opportunity to feel safe talking about my mental health until it got so bad that I had a suicide attempt. So we want to make sure that we are making sure people know that they can talk about it, that they can seek help, whether that's personal or professional, and that there are resources out there. But it's just so important that people know your health is your wellness. Without taking care of your health, you can do nothing more. So mental health is so important. And Dr. Liz will definitely be speaking to how mental health, physical health, and emotional health interconnect, and that we can't have mental health
combined
without the other aspects of our health.
Wow. Well, I want to thank all of you for being so open and sharing all the incredible things that are happening right here in Las Vegas.
Yes.
Right?
Yeah. Oh, man.
So with that, thank you, Chelsea. Thank you, Dr. Liz. Thank you, Ashley. We're going to have y'all all back because we got more to talk about.
Come on. Let us know.
Keep going.
Sierra, tell us more about what's happening in our city.
All right, y'all. So this Saturday, March 29th, from 9 to 4 p.m. at the center, there's going to be a Women's Journey Thrive Long-Term Survivor Summit. This is to celebrate women and honor women and girls for HIV Awareness Day with the Thrive Long-Term Survivor Summit. I will actually be there as well, speaking on the panel. Lunch and afternoon snack will be provided, as well as education workshops and vendors. And we're just not going to be talking about HIV, y'all. It's going to be talking about primary care needs, long-term survival panel, disclosure discussion, as well as having discussions about our breast and chest feeding updates when it comes down to maternal supports. We also have the National Healthcare Decision Day, which is planning for your future on April 16th, 2025, from 10 a.m. to 1 p.m. at the United Way of Southern Nevada. It is a free event. Why should you attend? You can come and learn how to communicate your medical wishes to your doctors, legally define your healthcare preferences for family and providers, and get that one-on-one advice for legal experts. So this is really an opportunity. There's going to be ASL, Spanish, and Tagalog interpretation available for anyone that may need it. There's also, you need some help navigating your Medicaid. You can reach out to Katie at 702-906-1859 or K Martinez at thecenterlv.org, where you can find support and have any questions answered and connect with resources regarding Medicaid and any other health coverage options. As always, we had a guest a few weeks ago. The pop-up produce stands will still be happening at Bonneville Transit Station on April 1st and April 8th from 11 a.m. to 2 p.m. and that's happening at 101 East Bonneville Avenue, Las Vegas, Nevada, 89101. And it'll also be happening May 6th and 13th. The AFAN Walk, y'all, AIDS Walk for Las Vegas is happening Sunday, April 27th. The festival starts at 9 a.m. and we'll start walking at 10 a.m. You can register at afanlv.org. And this Friday, there's going to be a vaccine clinic for all uninsured patients. It's walk-in anytime from 10 a.m. to 1 p.m. at the center, which is at 401 South Maryland Parkway. And it's an opportunity for you to get your vaccinations if needed. And then last but certainly not least, we have Las Vegas Community Day of Joy. Joy is something that is important. It is going to be a day filled with laughter. They say no titles, no logos, no ass, no negotiations, no politics, just fun, laughter, and creating memories. This is being hosted by the J Marshall. It is going to be Sunday, April 27th, 2025. There's going to be so many activities on the glass. It's free parking. It's going to be at Lake Las Vegas from 12 to 4 p.m. And I'm not going to lie to you, I got one more. This is tomorrow. It's called Girls on the Rise. It is a inspiring afternoon for girls in grades 6 through 12. It is a free event filled with empowerment, mentorship, and self-care, as well as refreshments, pampering, and incredible guest speakers. It's going to happen at the Whitney Recreation Center on March 27th, this Thursday from 3 to 6 p.m. So bring your young ladies out. And as Dr. Liz mentioned, we have the African Americans Men Health Summit, Prevention and Wellness, which will be happening Saturday, April 26th from 9 to 2 a.m. Not 2 a.m. My apologies. 9 to 2 p.m. 2 p.m. y'all. We ain't partying all night at the Doolittle Active Adult Center.
This has been A Healthier Tomorrow. I'm Will Rucker.
I'm Sierra Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately. We'll see you right back here in 2 weeks.
Bye, y'all.
Bye.